Are you thinking about using a form of contraception? Well then, have you heard of the injectable hormone contraception? The injection hormone contraceptive, or Depo-Provera, is an injectable hormone that can prevent pregnancies. The term Depo-Provera is named after a particular company that produces the hormone. To reach its full effectiveness, the injection should be received every 12 weeks without delay. The hormone that is injected to your body is in most other forms of birth control. Progestin. This chemical is natural to your body. Progestin, the natural hormone, tells your body not to release eggs from your ovaries. Without an egg, the sperm has nothing to fertilize, therefore, the pregnancy cannot occur. Another thing that progestin does is it makes the cervical mucus dense as an added measure to keep the sperm from reaching your eggs. The birth control shot is very effective. Studies show that if the hormone is used correctly, the chances of getting pregnant are less than 1%. If not injected regularly, the odds of getting pregnant while using Depo-Provera can increase up to 6%. Advantages of the injectable hormone is the effectiveness, but it can also start working right away. To have the shot work right away, it must be given within the first 7 days or 1 week after the start of your period, or within 5 days after a miscarriage or an abortion. It is safe to use on most women. However, in the case of all medications, some risks do apply and should be discussed with your doctor. There are more advantages to using Depo-Provera. For one, it's an alternative to the pill that you take every 3 months, so you do not need to remember to take a pill every day. This can promote the feeling of spontaneity in women because there's nothing to be done right before having sex. It is more private. You do not have to go through picking up medication from your pharmacist or going to other clinics like you would have to do with traditional birth control pills. Most women can receive the shot because it does not have estrogen like the pill, patch, or ring does. Depo-Provera is safe on women who are breastfeeding or for women who have estrogen sensitivity. It can also prevent against cancer in the lining of your uterus. There are a few disadvantages. This can include side effects, but most women have few problems and serious issues are not likely to occur. Some minor issues can affect longer, heavier periods, spotting between periods, or after multiple years of use, no period at all. Other side effects can include headache, nausea, sore breasts, but those are all common with the common menstrual cycle. This form of birth control does not protect against STIs, and if you cannot get to your doctor within the recommended time, backup birth control or other forms of contraceptions must be used. If you cannot get to your doctor within 2 weeks of your normal injection date, your doctor may ask you to take a pregnancy test or take an emergency contraceptive. In order to receive the injection, you must have a prescription. Many healthcare centers or clinics can provide you with this if you cannot see a provider, such as community clinics or Planned Parenthood. Your doctor may need to discuss medical history, perform an exam, or have you take a pregnancy test before administering the injection. Exams can be very low in cost dependent on your insurance, or in the case of seeing a clinic, the cost may be lowered according to your income. Talk to your healthcare provider about Depo-Provera and see if this is the right match for you.